All right, Kyle, I understand you just had total hip replacement done.
Yep.
So what I'm here to do today is just kind of explain to you some of the precautions that you need to have in moving around with your hip, and then we're going to get you up and we're going to get you walking using this walker today.
Okay.
Have you ever used a walker before?
No.
Okay, so I'll teach you how to use it, and we'll be just fine. In fact, let me show you how to use it first, so that way when we get you up, you already know how to use it. We're going to use a 3-point stance for it. So basically, you're going to move the walker forward, and well, it's going to be your left leg. So yeah, you want to move your left leg with it, and then bring your right leg forward. So move the walker and your left leg, right leg forward. Good, just like that. All right. So you're partial weight bearing on that, which means you can put a little bit of weight, but you don't want to put too much on it. You don't want it to be painful or anything for you.
Okay.
So as far as this left hip goes, you don't want to bring it across the midline. So if you imagine the line coming down from your belly button, you don't want to bring your leg over that line.
Okay.
You also don't want to internally rotate your leg too far. So you don't want your toe to point that way. You want to keep your toe pointing out as far as you can that way. The last thing you don't want to do is you don't want to flex your hip to 90 degrees. So you don't want it to come to where you bring a right angle right here. You want to keep that leg below that angle. If you do some of those, that may affect your surgery a little bit.
Okay.
Okay. So all we're going to do is we're going to go ahead and sit up. So if you can go ahead and bring yourself up onto your elbows, and then sit all the way up. There you go. And what we'll do is we'll have you swing your legs. And if you need help, I can kind of help you swing the leg around. But you want to make sure this one follows so it doesn't cross that midline. Are you able to lift it? Is that good, or can you need to go down?
I need to help.
Okay. That's fine. Okay. Go ahead and scoot forward to the edge a little bit. There you go. Alright, so how are you feeling there?
Good.
Okay. So I'm going to go ahead and put this gait belt on you. Have you ever seen one of these before?
I don't think so.
It's just to kind of help me get a good grip on you. If anything happens, you look to be doing pretty good today, but just want to be cautious. Alright, so we want this snug, but not too tight so that it's uncomfortable. Is that good?
Yeah.
Okay. What we'll do is we're going to bring this walker over in front of you. Alright, so what we want to do is you're going to have one hand back on the mat and one hand up. So we want you to bring this hand up to the handle there. Leave that one back behind you. Okay. So you're going to try and put your weight back here on this leg as you stand up, and I'll kind of guard this leg over here, your left leg, and make sure that it doesn't hurt too bad. And make sure during this you're kind of leaning back a little bit, just to keep from getting that 90-degree angle. Okay. So I'll go ahead and let you count to 3 and tell me when you're ready to go, and I'll help you as needed. All right?
Okay. 1, 2.
Good there?
Yep.
Okay. So now what we're going to do is you're going to go ahead and walk out a little bit to that table. We're going to turn around and come back. So, do you remember the stance I told you?
Yeah.
So, go walker forward. Do this foot. There you go. Perfect. Doing good. And as we get there, I'll have you stop once we get there so I can show you how to turn. Now what we're going to have you do is we want you to turn towards your right leg, okay?
Okay.
You're always turning away from the involved side. Okay? So you got to move the walker that way and pivot as you need to on that foot. How's that feeling?
Good.
Get back to the table, we're going to go ahead and back with your right foot. And then bring your impaired leg and the walker back. Okay, you feel the table behind you there?
Yep.
Okay, so go ahead and reach back with your right hand. Sit down and make sure you're leaning back a little bit just so we don't get that. There you go. There you go. Okay. We'll go ahead and get you going back into supine then. So what we do is have you lean back a little bit, and we're going to have you rotate. I'll bring your leg up, and just rotate a little bit. Make sure that you lead with that leg so that it doesn't pass that midline. Okay. All right, how you doing?
Good.
All right, thanks.